Welcome to SAANS Foundation, a super specialty foundation on respiratory, allergy, critical care, sleep disorders, rehabilitation, and skill training. It was started in 2000 in heart of New Delhi, and sooner it spread its wings in different parts of India and also abroad in US Virginia. SAANS Foundation believes in the philosophy. It believes that treat the disease as a whole, not as a simple hole in the body. And it is only possible when you give a holistic approach to the treatment. It has got different initiatives like Sarthak, which is a community outreach initiative, Saksham, which is a skill training body of SAANS Foundation. SAANS Academia is an academic portal for the professionals. Sahaj is an at homes is an home care unit, and SAANS Core Respiratory works in all kinds of respiratory and allied sciences. This was founded by Dr. Bose. Dr. Bose is a super specialist in the field of respiratory, critical care, sleep disorder, and rehabilitation. He's a postdoctorate and an MBA from University of Virginia, Durden. He's a founder of SAANS Foundation and also the Skill Training Academy of SAANS Foundation, the Saksham. He has innumerable fellowships. He's a recipient of Delhi Medical Association Excellence Award and also the Scroll of Honor from University College of Medical Sciences, Delhi University, for excellence in the field of respiratory medicine and incomparable services to the humanity. The SAANS Foundation has been recognized by many organizations nationally and globally, and Dr. Bose is involved in many organizations, and he's a key opinion leader in many of the pharmaceutical organizations and different health sector bodies. He has many publications and books, and one can really come to know about him if you visit his website www.saansfoundationindia.com. The people behind this SAANS Foundation are philanthropists, visionaries, and they are slowly joining this movement. Dr. Mausami Bose is an associate professor from Delhi University. She is a co-founder of SAANS and Saksham. Dr. R.K. Bose is a Fulbright postdoctorate from University of Pennsylvania, who is a senior consultant in World Bank. Mr. Radhakrishnan, a postgraduate from IIT, former director of DRDO and chairman of Alchemy Enersol International, a waste to energy international body. Professor Bala Gopal Nath Devarakonde, he's a PhD professor and head of the Department of Philosophy, Delhi University. Then, of course, one of the mentors, Mr. Ashok Sani, a visionary and a philanthropist, chairman of Sani Foundation, chairman of Swiss Military Worldwide, Major General Umang Sethi, AVSM, VSM, he's a chairman of Sani Saksham Skill Institute, Mr. Nirankar Saxena, Deputy Secretary General, FICCI, Mr. Muralidharan Tyagarajan, an IIT and MBA from Ahmedabad. He is the chairman of TMI Net, is one of the most sought after hiring agencies in India. And of course, Mr. Satish Kondakant is senior vice president for 4 pharmaceuticals. They are all putting their pivotal role in bringing out an excellence in the field of respiratory, allied sciences, and skill training. SAANS Foundation believes in certain values to achieve his vision, and he has created this a 360-degree approach to achieve his vision, and and its vision is to reach people and touching lives by the values of quality, reliability, trust, innovation, training, and empathy. It believes in the mission that it can save lives through a 360 approach, through Sarthak community outreach, Saksham capacity building, Samarth rehabilitation, Sahaj home care, and clinics in chest medicine, a academic platform to bring a 360-degree cohesive approach in the field of respiratory and allied sciences. It strictly believes in the values of empathy, not sympathy. It believes that humanism is the most important part of achievement, and it empathizes in the patient care of system, and that is a core value of the SAANS Foundation. SAANS Foundation believes in the scientific principle of more breath per breath. It has innovated many breathing techniques, and by structured, tailor-made breathing techniques, it has reversed many chronic lung diseases through its power breathing techniques. SAANS is avidly covered in different media and academic circuits. It runs a newsletter to sensitize the community at large. It has an association with so many bodies, from SANI Foundation, who has been supporting tremendously to develop the skill training and the field of excellence in the field of respiratory and allied sciences, to the pharmaceutical like Cipla, global giant Astra, Indian multinational Forts, Lupin, non-invasive ventilation, or the Sleep India giant in the world, Respect from Australia. SAANS Foundation has been recognized by Director General of Health Services as a super specialty nursing home. It is associated with academic institute like National Heart Institute. It has an association with Mulchand Hospital, Fortis Group of Hospitals. SAMA is a rehabilitation unit and a skill training institute of SAANS Foundation. Then also it is associated with different social bodies like FICCI, ASSOCHAM. It is doing pilot studies with Delhi University, Ramlaj College, Indian Council of Philosophical Research, and its Saksham bodies recognized by Health Sector Skill Council and many more. SAANS Foundation believes that if you want to treat the disease, the patient has to be educated. It believes in educating the patient through different image-based and dialogue-based audiovisual activities. Every patient is given an image, and the patient condition is educated through an audio-video interaction. These are the common diseases which are treated at SAANS Foundation: the asthma, chronic obstructive lung disease, allergic disorders, lung fibrosis, tuberculosis, pleural diseases, pneumonias, cardiorespiratory dysfunction, cardiomyopathy, rehabilitation of post-COVID or any kind of lung diseases, advanced critical care using ventilation and non-invasive ventilation, nutritional programs, and metabolic diseases which affects your respiration. So it is practically addressing all chronic respiratory and allied specialties through his patient-centric educational approach. It has innumerable recognitions. Since its inception in 2000, it has got recognition from Global Initiative on Asthma, which is the main body of asthma advocacy in the world, World Health Organization, American College of Chest Physicians, International Journal of Neurosciences, recognized SAANS for its excellence in the sleep and allied sciences, FICCI, Millennium Alliance, USAID, TERI, the Energy Resource Institute, which is a nobly recognized organization, and of course the Cleveland Foundation US, and many more. SAANS Foundation was shown on the global map as one of the foundation of excellence in the field of sleep advocacy in the world, and it got a tremendous amount of recognition and positioning in the global map, and other organizations which were recognized. They were all international bodies represented by the countries. In the whole of Asia and Africa, the SAANS Foundation was recognized for its research and advocacy in the field of sleep medicine. SAANS Foundation was recognized as a super specialty center of excellence by Director General of Health Services, Government of India, National Capital Delhi. It is recognized as a super specialty nursing home and skill training center. SAANS has shows his presence in all kinds of media outreach and wellness columns. Practically any newspapers, any journals, all leading social media, the SAANS has a presence. Outlook and other leading journals regularly cover SAANS Foundation for his patient education and academic activities. And the different initiatives believes that the doctor-patient relationship is not one-sided but reciprocal. It believes that patient is the boss, patient is the supreme, and it believes in empathizing with the patient and develops a rapport with the patient. The SAANS regularly runs a newsletter to sensitize the population at large. This community outreach initiative of SAANS basically to sensitize people about the right kind of practices in respiratory and allied sciences. The SAANS initiatives, as we mentioned, the Saksham, Samarth, Sarthak and Sahaj home care initiatives, other than his academia called clinics in medicine. In Sarthak, the community outreach van of SAANS reaches out to the people in low socioeconomic strata to help people to come out of their respiratory problems, to create an advocacy on preventive basis. It reaches to the community on regular basis to do lung function tests, to questionnaire-based studies, so that the people can be benefited through preventive strategies. And it believes in early detection and treatment through its regular community outreach mobile units. SAANS Foundation, if you see its presence, practically any kind of community outreach initiative in Delhi NCR and many more. This slide is just to depict how active is SAANS in different community outreach initiatives. In the COVID time, the SAANS didn't stay at home. It reached to the community to sensitize people. It created an initiative called Fight COVID Initiative. Fight stands for feel good, I for enhance your immunity, G for do a lot of gargling to reduce the viral load, H because we are there to help you, and T is that to the therapeutics part of it. The Fight initiative is a logo which was very popular. We reached out through social media, through grassroots initiative. We distributed masks, hand sanitizer free of cost to all sections of the population, and it continuously played a role to help people procure oxygen cylinders, reaching out to the community. And SAANS Foundation throughout in 3 years have been very actively involved in COVID care management. Saksham is a capacity building in healthcare sector. It believes that if the healthcare believes in good care, there has to be a continuity in healthcare, and that continuity is possible if there are skilled people. The doctors and nurses alone cannot change the healthcare system. To bring a continuity in care, right from the bottom to the top, everybody should be skilled. Right from the doorman to the healthcare worker to the technicians, to all levels of skilling is the philosophy of the SAANS Foundation. Saksham is a skilling body of SAANS. Basically, the Saksham believes that the informally trained people can be formalized through good structured training program, and that can really change the healthcare delivery system in the society. Saksham skill training basically believes in nurturing talent and concerns. It is recognized by the Healthcare Sector Skill Council, Government of India, and more than 5,000 healthcare workers already been trained and placed in different hospital and allied services at different home care levels for its 2 main courses, which is recognized by the Healthcare Sector Skills Council, Skill India, General Duty Assistant and Emergency Medical Technician. Presently, this Saksham skill training in association with SANI Foundation is working very hard to change the Rangpuri cohort of villages. It is already running a structure scaling program, and it is a plan to scale up the whole system, and with a philosophy to skill the whole village, a population of more than 5 lakh population. It's an initiative of SANI Foundation and the Saksham Skill Training Initiative. Saksham believes in sensitizing the unemployed youths, and it reaches to different cohorts, different difficult situations, difficult areas, so that people can be educated to skill up so that they can become self-sufficient. Saksham means self-sufficiency, so that they can earn for themselves, they can help the community, and overall the community benefits. Here are the students. This is the first batch of Saksham students. They are happy with the certificates, and the Saksham belongs in A. That's why A is capital. It believes that if you are acceptable in the society, you should have all the good A qualities. You should have the right attitude. You should be affable. You should be addressable. You should be available. You should be able. You should be amicable. All A's are possible if you regularly follow a structure program. That's why Saksham believes in soft skills. Soft skill is the most important component of the Saksham skill training program, and Saksham trains the people based on the structured training program of attitude, skill, and knowledge. It believes that if you can't bring an attitudinal change in healthcare worker, the skilling and the knowledge doesn't make any sense. So it gives a lot of impetus to the skill training through its soft skill attitudes, and it tries to make the people A, the availability, affability, amicability, addressability, all good A qualities make a patient acceptable and able. This is the whole philosophy of Saksham, a self-reliant, self-sufficient skill training institute where the community at large can play major role in improving the healthcare delivery system. And it is also a conduit to bring a continuity in healthcare delivery system, a person from hospital to the home. These trained healthcare workers, they can play as a conduit to take care of the patients at the home, from hospital to the home level. In the COVID time, Saksham played a very pivotal role. Most of the Saksham workers created a change, and through this change, they are creating a change. It believes that a change is possible by engaging, talking, influencing, motivating, and connecting people, and that is the Saksham philosophy. These healthcare workers, they're bringing a tremendous amount of change in the society by creating an empathetic patient care delivery system. Saksham certificate mentions it's an internationally paramedic course, a multitasking health worker course for the hospital, home care, and disaster management, an initiative of SAANS which was supported by FICCI and National Heart Institute. And there in the certificate, we mention everything which the health worker has learned, right from soft skill, the knowledge, to every possible skill, right from measuring the BP, pulse, oximetry, taking ECG, X-ray, blood sugar monitoring, basic physiotherapy, patient care, nursing care, bedsore care, all possible things which a person needs at home or at the hospital level. That is a Saksham all about. So Saksham certificate speaks on all this, and that's why these healthcare workers are getting adequately placed in the society. It is affiliated by Skill India, Health Sector Skill Council, and now the Saksham is going to the next level. It is scaling up. It has already started a skill institute with SANI Foundation in Rangpuri. The SANI Foundation, under the leadership of Mr. Ashok Sani and General Umang, with SAANS Foundation, they have a vision to make it one of the finest skill institutes in India. General Umang is playing a major role in developing and skilling, and it is right now already setting an example by creating a role model, patient care, home care based, charitable, hospital, home care at Sani Foundation Vidhashram. This is a pilot study which they are doing it, and we are very sure this model will be replicable, and this ideal model of Sani Foundation with Saksham will bring in huge change in the community, and in the months and years to come, this model will be replicable and scalable. Samarth is the rehabilitation and wellness unit. These are run by trained therapists, master physiotherapists, psychologists, philosophers, and it believes that there is a disease spiral of disability, because even with the best treatment, the body goes into a kind of in basically in respiratory and allied diseases. When there is a chronic disease, there is a use of drugs, there is a drop in oxygenation, there is a chronic inflammation, there is a poor nutrition. This causes a peripheral muscle dysfunction, and when there is a peripheral muscle dysfunction, then what happens? You feel fatigue, you don't work out much, there is a deconditioning. So increased breathlessness, reduced activity causes depression, social isolation, all put together causes severe deconditioning, and this is what is called disability. And this disability and peripheral deconditioning and peripheral muscular disability, muscular dysfunction causes chronic disability, and that is one of the biggest challenge. So the drugs are not enough. So this our trained therapist is believing in reversal of chronic diseases through a structured lung pulmonary rehabilitation program. It believes that endurance, you can, with your little lung capacity, you can do more if a person is motivated enough, if they are mobilized enough, if they bring a thought process in the change through the cognitive behavioral therapy, which works on the principle of thought, behavior and action, with the right kind of nutrition, breathing techniques, good amount of yogic techniques, and high intensity repeated exercise and specialized breathing techniques. It is possible with a chronic disease who are worsening, they can revert back with a structured pulmonary rehabilitation program. SAANS Foundation is also working on a lot of rehabilitation. Is smoking rehabilitation program or tobacco rehabilitation program is quoted worldwide. It has done innumerable studies in quit tobacco rehabilitation program. It believes in cold turkey approach, where those who are in tobacco, they are sensitized at a particular day. Finally, they are the foundation, the people who have been working as a therapist, they motivate patient to quit. All of a sudden, this is called a cold turkey, and they're the kind of ecosystem which is created to motivate the patient, which is very unique of SAANS Foundation. And that's why this philosophy of quitters of winners, it's an almost a 90 to 100% rehabilitation rate or quit tobacco rate in SAANS Foundation treatment program. The Choose Life study, which the SAANS has done, it's one of the largest pilot study they did in smokers. They found that if you really want to bring a total change in the mindset of the smokers or people, those who are consuming tobacco, so you have to take care of their mindsets. That's why they found that stress level is very high. The anxiety level is very high among tobacco consumers. So Choose Life study under the leadership of Dr. Bose proved that if you don't attack the mindset by simple quit tobacco program, it doesn't, and that doesn't work. And that's why this quit tobacco program of SAANS Foundation is so exclusively and so effective. It also believes that being healthy is not enough. More important is wellness. It believes that every person is ill. Even if he has a fit body, there may be a mental health. So this is a decade of mental health. So wellness is a very important area of SAANS Foundation, and recently it has been recognized by Delhi University for doing the very long-term wellness programs supported by Indian Council of Philosophical Research. It is basically helping people to move from a 360 degree, what you call a holistic harmony, from mental health to emotional health, to environmental health, to spiritual health, to intellectual, to academic, to your financial, to finally a cosmic wellness. This structure questionnaires have been designed. Already this study has been going on with the Delhi University, Ramjas College, Department of Philosophy, Delhi University, and SAANS Foundation, and this is going to be one of the landmark study. And already the results are very exciting, and we are helping people to achieve wellness. Even with a poor physical body, with the right kind of mental health, emotional health, environmental health, and other supportive health, one can achieve a tremendous amount of blissfulness and sense of well-being. This structural approach is a journey, what we call a 360-degree holistic journey, and this is one of the innovations of SAANS Foundation. And this program has been managed by doctors, philosophers, psychologists, and therapists. And this is a very passionate program of SAANS Foundation with Delhi University. And it believes that sooner with this concept, the new term in health will come, what is called wellness. So one has to move from health to wellness. In COVID time, it has seen the mental health really affected the people. If you can change the mental health and emotional health, the patient starts starts improving. So it's a kind of a holistic harmony. By changing the neurochemical hormone release in the body, especially at the mind level, one can achieve this change. And this is a very structured, supportive, skill program, and many of the patients are getting benefited. It is already recognized by Indian Council of Philosophical Research in this program called this project is also called SAANS. It is a systematic analysis and approach to neuro philosophical counseling. So basically, we will be depending upon the score. We are going to, treat patient through different physiological counseling. Like for example, if somebody has a mental health, he will be given cognitive behavioral therapy. That means thought will be changed and according to behavior and actions. Those who have an emotional health, they will be given rational emotive behavioral therapy. That means we make them people rational. Those who have a social wellness means when you are not able to connect yourself, it's not that you have so many social friends and all. When you have a social wellness, when you're feeling listless, depressed, they will be given a logical behavioral therapy. It's a very innovative interdisciplinary program between respiratory physician, therapists, philosophers, psychologists, and nutritionists. And a lot of students, the university students, are volunteers who are playing a role to bring out something which is very unique called wellness. Sahaj is the ultimate home care concept, and this is only possible when you have a good Saksham trained people. It believes that total home healthcare solution is possible where care is tactile with a smile. We believe that touch is very important with a smile. That is a philosophy. And at home care program, we have programs for chronic care, geriatric care, palliative care, rehabilitation care, post-surgical and long-term care, and all these cares we have structures. With us, the largest quality nursing bureau is working. We have more than 500 nurses and skilled people who are helping us to achieve this. Thousands of people got benefited during COVID time with our structured home healthcare program. So if you have any kind of home healthcare issues, this is a standard literature which is circulating social media, right from sample collection, physiotherapy, nursing, critical care, medicine delivery, medical equipment, doctor's visit to patient assistance. This is SAANS has been doing, and this is one of the philosophy which SAANS and SANI Foundation will be doing together to create a change at the home care level. SAANS breathing life into home healthcare has been, these are that some media has been talking that SAANS has been very aggressively working in home healthcare through his skill training programs. Then of course, nothing is possible without good academic knowledge. It also believes that percolation of knowledge is only possible with regular structured program, updated program, which is, so SAANS started a forum called Clinics in Chest Medicine. Is an international program supported by Force India, basically to sensitize, educate and upgrade professionals in the field of respiratory care practice through certification courses, hands-on training, webinars, and this is what we call podium to portal, and already in Delhi chapter has been very successful, attended by the best of the pulmonologists from India. Recently, the SAANS Foundation has done the Tamil Nadu chapter very successfully, and this under the Clinics of Chest Medicine, the SAANS Foundation written a lot of textbooks on respiratory and allied sciences, and a textbook on COVID will be released in their National Pulmonary Conference, which is in next month in NAPCON 2022 in the month of April. This NAP COVID manual will be released. So SAANS believes in a lot of academic activities. So this is basically the clinics in chest medicine with the logo that we are holding the lungs tight. So basically, unless and until we educate, unless and until we inform, educate, and communicate with the professionals, this specialty cannot go to the next level. These are the different activities we have been doing, and now this academy believes in creating regions. They believe that this is a kind of hub and spoke through clinics in chest medicine with a very structured portal. It will create regions in different parts of India and abroad so that these doctors can create the second level doctor. This is a kind of what we call change with a chain. This is a CICM or clinics in chest medicine regionship, which the clinics in chest medicine under the SAANS Foundation and Force, they have been doing it. Lots of books. The SAANS Foundation under the leadership of Dr. Bose has been written. These are the different international workshops, which was the first sleep workshops were done by SAANS Foundation initiative in 1996. These are different books on sleep disorders. The SAANS Foundation has contributed in different national congress, like EPICON is one of the largest physician conference in India. National Pulmonary Conference, the largest respiratory conferences, which was practically done with the international chest bodies supported by Dr. Bose SAANS Foundation. Then Pulmonary Critical Conference in Escorts. They played a very important role, in writing the books for the postgraduates. These are the chest summit 1 and 2 was done in partnership with Escorts and other doctors. Sleep Medicine Journal regularly Dr. Bose is co-authoring to create dissemination, and Indian Sleep Disorder Association is one of the founder vice president. This association was brought in India because sleep was in infancy, and this is a regularly a training model under the Indian Sleep Disorder Association, where the Dr. Bose is one of the founders, and now it gives fellowship in Indian Sleep Disorder Association called FISDA. All those people, those who have been practicing sleep disorder medicine, what you call sleep apnea and related diseases, this is through FISDA only in India. Regular newsletters, choose life study, books on mechanical ventilation, asthma in different languages, manual for respiratory care practitioners, manual for chest diseases, manual on COVID. Even there's a book on breathing techniques of SAANS Foundation is followed globally. This is a book, The Tortoise Breathe Better, Live Longer. If you breathe like a tortoise, live like a king. This is Dr. Bose's philosophy. His breathing techniques of power breathing are followed across the globe, and it's been quoted in many of the books. And here the patient speaks. If you visit the Google review, it has got 4.6 out of 140 reviews, and people speak very excellent of the care. One of the leading journals have covered in the COVID times for his heroic activities and healing activities. He has been treated with a lot of praise and all as an angel. So a friendly doctor. So media also, the SAANS Foundation has a huge digital presence, and we believe not only in direct seeing the patient, a hybrid model, a 360-degree model, hub and spoke model through teleconsultation and other things are also very active in the SAANS Foundation. So dear friends, Dr. Bose believes that a holistic care is possible, a continuity in healthcare delivery system is possible if you believe in right advocacy, right skill training, right knowledge dissemination, taking the patient right from the hospital to the home care with the right home care techniques, treating the disease as a whole, not as a whole, and that is what he called the aptitude. And he believes if you have the aptitude and attitude, it decides your altitude. Thank you. If you want to know about SAANS Foundation, please visit its website www.saansfoundationindia.com. Thank you.